Thank you, Madam President, Royal Highness, Director General, dear ministers, ladies and gentlemen. Better health for Europe, more equitable and sustainable. That is what we agreed to work for. Last year was challenging. We fought Ebola, we saw children dying from measles and diphtheria. Now we face cases of polio in our region. And there is a large influx of refugees and migrants, with many people asking for help. We made good progress in many areas, but we must do more, and we must do better in some. One key Health 2020 indicator, like life expectancy, demonstrates good progress, as Europeans are living longer, and the differences between countries in health outcomes are shrinking. A clear sign that inequalities are declining, and Health 2020 works. But the gap between the countries with the highest and lowest life expectancy is still 11 years. The region is on track towards reducing premature mortality due to decline in cardiovascular diseases, and Europeans are reducing their health risk behaviors. But people in Europe still smoke and drink more than anywhere else in the world, and they are among the most obese. More decision makers are making coherent and interconnected government policies with a strong intersectoral component and using Health 2020 as a way forward. From 2010 to 2013, the proportion of countries with national health policies aligned with Health 2020 almost doubled, from 38% to 70%. And I am proud of this. This progress demonstrates what we can do if we are committed and work together, but it also shows that we have many challenges ahead, confirming that the key strategic directions of the Health 2020 remain more relevant than ever before. All the determinants of health, social, economic, and environmental challenges and demographic changes affect both people's health and health systems. Migration, the aging of the population, and health workforce mobility are only few examples. Only the governments that put health and well-being high on their social, economic, and development agenda will be able to overcome these challenges. Health is a political choice. In essence, Health 2020 supports making the right political choices for health. Our key role is to protect health as a universal value and to promote it as a social and political goal for governments and societies as a whole. The economic case for investment in health is strong. Investing in health generates cost-effective health outcomes and economic, social, and environmental benefits. The health sector's call on government to invest in health will make this change happen. We need to give this message loudly. For example, current evidence suggests that investment in reproductive, maternal, and child health has a potential return of more than $20 for every dollar spent. The argument for investing in the best buy interventions is equally clear for addressing non-communicable diseases. Tomorrow, we are proud to launch the study on the economics of prevention, one of the Health 2020 studies prepared by the Regional Office, the European Observatory, and OECD. I would like to use this opportunity and thank the government of Belgium for hosting our observatory. Current investments in health and public health are not sufficient. We need to invest more. It is alarming to see that between 2007 and 2011, the health share of public spending fell in 24 countries in Europe. By tapping into new sources, improving efficiencies, and giving priority to health, I am sure that all countries can find ways to raise sufficient funds for health. But they cannot do this on their own and need to work in partnership, especially with those responsible for social and fiscal policies. Ladies and gentlemen, development is impossible without better health. Health is a precondition for alleviating poverty, as we heard it from Her Royal Highness, and an indicator and outcome of progress towards a sustainable society. This is an exciting year. Within 10 days, world leaders will gather at the UN summit to adopt the agenda for sustainable development to end poverty by 2030. The agenda has universal goals that will apply to every nation, not just the developing countries. Among the 17 Sustainable Development Goals, the one for health is central. It aims to ensure healthy lives and promote well-being for all at all ages. There is increasing acceptance that the new health goal must also aim to achieve universal health coverage in every community, in every country of the world. The formulation of the health goal is fully aligned with Health 2020. This was confirmed at the regional consultation for the post-2015 development agenda, where Health 2020 was defined as the regional framework for this new vision for health. Focusing solely on the health goal would be a missed opportunity. All the Sustainable Development Goals will influence health because they all address the determinants of health. The 2030 Agenda will link different dimensions of development, including health, to the environment, to prosperity, and to all actions and policies that people need. Now we have a historical political responsibility to pursue the integration of health and well-being in each and every goal. We have the opportunity to put into practice the whole of government and whole of society approaches to which we subscribed through Health 2020. The new development agenda will call for translating it into national development plans with health at its heart. We are fully committed to supporting you in implementing these national development plans. Ladies and gentlemen, Health 2020 is key in this renewed policy environment, and the expectations we formed in 2011 are becoming reality. All member states have shown incredible enthusiasm in embracing the principles of Health 2020. You are showing us that real improvements in health can be achieved if we work across government. Intersectoral action is essential for policy coherence and provides the basis for accountability in health. It is therefore the major theme of this regional committee. Intersectoral action for health requires political commitment. It should focus on key public health priorities and upstream interventions by addressing the determinants of health and health equity, and strive for maximum impact by creating win-win partnerships. Our region has much experience with intersectoral action, for example, the international health regulations, antimicrobial resistance, health system financing, working with ministries of finance. One concrete example is the European Environment and Health process. With its 26 years of experience in intersectoral work, it has proven to be a good model. It brings together different sectors on equal footing, and the Environment and Health Ministerial Board illustrates the importance of a well-constructed political process. The European Environment and Health Task Force ensures accountability and establishes a link to national implementation. Generously supported by the government of Germany, our office in Bonn provides evidence and technical support to address environment and health challenges in our region. We are grateful for Israel for hosting the successful midterm review meeting in Haifa. It provided clear directions towards the 6th Ministerial Conference on Environment and Health planned for 2017. I invite you all to actively engage in the preparations. Health 2020 prioritizes the social determinants of health and health literacy. Social policies ranging from employment and education to housing must be a strategic priority. We discussed this at the meeting in Paris in April and the Small Countries Initiative in Andorra in June. Health has great significance in foreign policy processes and development cooperation. We discussed this in Berlin in April and at the International Health Forum in Ashgabat in July, and we will continue to support member states in the year ahead. We look forward to learning from your experience during the ministerial panel tomorrow. Taking leadership in intersectoral processes requires a new mindset and capacities in health ministries. These processes are ongoing and showing positive results. We are supporting the establishment of intersectoral committees in countries. We developed sectoral and thematic briefs, policy briefs, to contribute to their agenda setting and the successful outcomes. European consultative processes to engage member states who are interested to join will help promote intersectoral work across the European region in support of national implementation. They will allow dialogue, sharing of experience, and common actions between countries, institutions, and sectors. We suggest that they focus initially on education, finance, and social sectors to promote social determinants and health literacy. Ladies and gentlemen, we worked intensively on the successful development and implementation of national policies aligned with Health 2020. Networks became a more powerful platform for sharing practical experience with implementing Health 2020 among the countries. For example, the countries of the Southeastern Europe Health Network are committed to intergovernmental and intersectoral action and agreed to further scale up implementation of Health 2020, which is in line with the Southeast European 2020 strategy. The Small Countries Initiative is another efficient network inspired by Health 2020. Its members are committed to aligning the national health policies and implementing Health 2020 vision as shown by the San Marino Manifesto and the Andorra Statement. I am honored to have received the San Marino Order of Sant'Agata last month for improving health in San Marino and throughout the region. This award is a clear recognition of the value of Health 2020 and the work of WHO. Local leadership and intersectoral action is very important and can be innovative. The Healthy Cities and the Regions for Health Network help to support subnational implementation and sharing of good practices. We shall hear more about this tomorrow. Thanks to the government of Italy for supporting our office in Venice for investment in health and development, which contributes to our work in this important area. Now let me move to communicable diseases. While the region has made much progress, these diseases still challenge Europe's public health. Over the past 5 years, the region has made major progress in the fight against tuberculosis. Over 1 million TB patients were cured. About 200,000 cases of multi-drug-resistant TB were averted, and more than 2.6 million lives were saved. The incidence of TB dropped by 6% during each of the past 5 years, the fastest decline of all WHO regions. All patients detected with MDR-TB received treatment, compared to only 63% in 2011. Extensive actions and initiatives taken in partnership with your leadership and commitment made this possible. You reiterated your commitment in the Riga Declaration at the first Eastern European Partnership Conference in March. Thanks to the Latvian presidency of the European Union for its leadership. Yet, this is not enough to end the TB epidemic by 2035 and eliminate the disease by 2050. Through the proposed European TB Action Plan, we estimate that more than 1.4 million TB patients will be cured, 1.7 million new cases will be prevented, and over 3 million lives and $48 billion will be saved. It will be presented to you on Wednesday, and I call for continued commitment to make our dream of eliminating TB in our lifetime come true. Unfortunately, progress towards HIV control is not as good. With 136,000 new infections, 2014 was the year with the highest number of new HIV cases, a staggering 80% increase since 2004. Since 2010, I have repeatedly called your attention to this alarming situation, calling for concerted action. Evidence is available. We know what works. Only bold action in implementing evidence-based policies will get us on track to end the epidemic by 2030. Viral hepatitis remains unaddressed throughout the region, with 13 million people estimated to live with chronic hepatitis B and 15 million with chronic hepatitis C, leading to 400 deaths related to viral hepatitis a day. Even though treatments are now available for hepatitis B and C, access and affordability remain a challenge for most countries. We must take a comprehensive approach to fight this silent killer, using available tools and focusing on prevention. I look forward to your input to define how the regional office can support you in controlling these public health threats when we discuss the global health sector strategies on Thursday. We are very close to a historic achievement, eliminating malaria by the end of 2015. As of today, there are no locally acquired malaria cases in the whole region. Let me congratulate you all on your commitment and dedication in partnership with all stakeholders. The achievements are huge, but the situation is fragile, and we must remain vigilant. I request all of you to maintain the highest political commitment. This will be the focus of a high-level consultation in Turkmenistan in February next year. Vaccine-preventable diseases continue to burden our region. The loss of a child from diphtheria, the death of children from measles complications, alongside thousands of cases of measles, represent solemn reminders of unfinished business. Accepting the status quo is not an option. There is no stronger reminder of the need for vigilance than the return of polio. The report of 2 cases in Ukraine on the 28th of August is alarming. particularly given the large pockets of susceptible populations who could be exposed to this crippling, deadly disease. We immediately deployed a rapid response team to start case investigation and risk assessment. We are supporting the Ministry of Health in preparing for 3 rounds of national immunization campaigns. Vaccine is being distributed in the country as we speak, and the first round of the campaign will start this week. I commend the Ukrainian authorities for their commitment of taking actions for a rapid response. I also thank the Global Polio Eradication Initiative partners for their support. It is imperative that Ukraine and all European countries continue to mitigate the risks posed by polio by maintaining high immunization coverage and surveillance. In adopting the European Vaccine Action Plan last year, you committed yourself to eliminating measles and rubella by 2015. While many countries are on track to do this by the end of this year, the regional goal continues to elude us, owing to the lack of steadfast political commitment in some countries. I need you, leaders, to stand by your commitments to eliminate measles and rubella. The 10th anniversary of the European Immunization Week, celebrated throughout the region in April, included some of the most interactive and high-profile efforts to promote immunization we have seen to date. I was honored to visit Tajikistan with Her Royal Highness, the Crown Princess of Denmark, in October to advocate stronger immunization delivery and increased investment in maternal and child services. Ladies and gentlemen, in the area of NCDs, we continue to see significant advances in implementation of the action plan for the prevention and control of NCDs. We continue to see a decline in mortality from cardiovascular diseases in almost all the countries. Declines in behavioral risk factors, including smoking, and biological risk factors such as high blood pressure and serum cholesterol contribute to these reductions. The overall consumption of alcohol is falling by about 2% a year, and tobacco smoking among adults continues to decline. Nevertheless, ours remains the region with the highest overall rate of adult smoking. I am proud that our countries are taking global leadership in plain packaging for tobacco products. France, Ireland, and the United Kingdom were pioneers, and several other countries announced their intent to follow. Congratulations to the WHO Framework Convention of Tobacco for a decade of action. Since my last report, 4 additional countries in our region have become parties to the protocol to eliminate illicit trade of tobacco products. I congratulate them and call on others to join. On Wednesday, we will discuss the proposed roadmap for tobacco control, setting an ambitious goal of full implementation of the FCTC. We are grateful to Turkmenistan for its pledge to support implementation of the roadmap in the coming years. We will also discuss the physical activity strategy of the region, which complements the action plan on food and nutrition adopted last year. Our achievements since then include attaining a membership of 30 countries participating in the Childhood Obesity Surveillance Initiative. Member states have approached me to express concerns about the neglect and abuse of adults with intellectual disabilities who live in institutions. This challenge requires intersectoral action, and we cannot ignore this as a region. I have initiated a review and will report back presenting the way forward. There is strong evidence that improved medical care is a strong contributor to declining illness and mortality from CVDs. We will review this new evidence at the International Conference in St. Petersburg in November. It is my special plea that Europe increases its attention to the management of NCDs. While re-examining its programs for early detection and screening, we developed a package of 15 essential interventions to tackle NCDs, which is being implemented in 23 countries. All of these are core components of the package. Our capacity to respond to NCDs this year increased with the launch of the new geographically dispersed Office for NCDs in Moscow. We are grateful to the Russian Federation for its support. Ladies and gentlemen, many countries are applying the life course approach in developing their national policies or improving collaboration between sectors, which is a key strategic direction of Health 2020. The European Ministerial Conference on the life course approach to be held in Minsk in October will be the first event linking the Sustainable Development Goals with Health 2020 and focusing on maternal and child health, as well as reproductive health and rights. I would like to thank Belarus for hosting this important event. We are making progress in improving women's health, but wide inequities between and within the countries exist and remain. The use of modern, effective methods of contraception is alarmingly low in many countries. Some countries have the highest abortion rates in the world. Effective perinatal care resulted in the decrease in the major killer of mothers, the severe obstetrical bleeding. Now is the time to focus on pre-existing medical conditions, such as diabetes, obesity, CVD, and mental diseases that are exacerbated by pregnancy. More needs to be done on sexual and reproductive health and rights, an area we plan to bring to your attention in the future. We will outline the European Women's Health Report to be published in 2016 at the technical briefing today. Ladies and gentlemen, our work to strengthen health systems and public health capacity aims to improve health outcomes in an equitable manner, ensuring financial protection, responsiveness, and efficiency. The Tallinn Charter guided this work, and we will present the final report on its implementation on Wednesday. This report fed directly into the new vision for health system strengthening for the next 5 years. Transforming health services to match the needs of the 21st century is the strategic priority of this new vision. This new vision reaches out to the voice of the people. It will provide health leaders with an inclusive approach that harnesses feedback from citizens in designing health systems that are more responsive to their needs. Coordinated, integrated health service delivery towards people-centered care is the way forward. We scaled up our efforts and are preparing an action-oriented framework that will be presented to you, to the Regional Committee, next year. Taking forward the renewed vision of the Declaration of Alma-Ata and integration of essential public health functions, we support countries in revising their delivery models for primary health care with a focus on quality. The inauguration of the GDO on primary health care in Almaty in February expanded our capacity. Thanks to the government of Kazakhstan for its support. The World Health Report estimates that in 2010, 19 million people faced catastrophic payments in the region. And 7 million face impoverishing expenditure. Universal health coverage is central to addressing this challenge. We are working on updating these estimates and have accelerated our support to the countries. Annual training courses delivered by the Barcelona office were a continuing success. Many senior officials from 33 member states benefited from one of the two courses in 2015. Let me thank the government of Spain for its continued support to our Barcelona office for health system strengthening. We are addressing health systems barriers for specific diseases and conditions, including communicable diseases and NCDs, which are then translated into policy decisions and actions. We are now broadening the focus to include environmentally sustainable health systems. Ladies and gentlemen, our collective investment in health information, evidence, and research as the basis of policymaking is paying off. Since its launch in 2012, the European Health Information Initiative has been the umbrella for all health information activities, and I encourage you all to join. Let me now highlight some of the initiative's main achievements. We continue to work on the development of information on health and well-being with a focus on indicators. This year, we examined new evidence on cultural determinants, which will help us consider the impact of culture on health and well-being across the diverse European region. We supplied a wide range of information and analytical resources, including the new Health Information Web Portal. It is widely used by policymakers and soon will allow simultaneous analysis of indicators in all databases. In addition to tools for health information strategies and national e-health strategies, we actively supported the conference on e-health held in Riga during the e-health week in May. We launched a new bilingual journal, the Public Health Panorama, to highlight successful examples in the countries. We are launching the second issue with a special theme on intersectoral policies at this regional committee. The annual Autumn School on Health Information and Evidence for Policy, hosted by Poland in October 2014, was a real success. As you requested, we organized an advanced workshop on health information and data assessment in Moscow in July 2015 to give more in-depth training. The Central Asian Republic's Health Information Network is a platform for improving health information systems. The Evidence-Informed Policy Network Europe aims to build countries' capacity. We will discuss this at the technical briefing on Wednesday, when we present an accelerated roadmap for evidence-informed policies. The Health Evidence Network provides synthesis of the best available evidence for policymakers. We launched 2 reports last year. 3 more on migration and health will be presented at the ministerial launch today. Ladies and gentlemen, the recent Ebola outbreak in West Africa demonstrated that the international community is not sufficiently prepared to manage major health hazards. We contributed to the response by deploying 25 staff on 36 missions from the regional office. We are grateful to all partners and member states for their support for the response. This is a defining moment for change. We have to ensure that the world is adequately prepared to effectively detect and respond whenever and wherever an emergency with health consequences strikes. We are fully committed to taking all necessary action. This is clear in the statement issued in March by the Director General and the 6 regional directors. We are moving ahead with the 6 areas of work outlined by the Director General, and we will discuss progress and next steps later today. In the regional office, we take an integrated, generic all hazards and multi-sectoral approach to preparedness for both humanitarian and public health emergencies. Risk communication is an integral element. Back in 2010, I merged 3 areas of work: outbreak, alert and response, the international health regulations, and the country emergency preparedness, under a clear command and control system. We continuously screen signals of potential health threats. We revised our emergency procedures, and the Emergency Operations Center at the regional office functions as a regional hub. Compliance with IHR obligations is crucial for national and global health security. Many member states have raised the need to supplement the self-assessment of core capacities with independent evaluations. Your input to the proposed global approach to IHR monitoring and evaluation is critical, and I look forward to the discussion on Thursday. Better Labs for Better Health is a new initiative that we launched to improve the laboratory capacity to detect and respond to diseases and outbreaks. It is an important component of IHR core capacity, and I ask member states and all stakeholders to join this initiative to make it a success. We will soon sign the host agreement with the government of Turkey to establish the GDO in Istanbul for preparedness for humanitarian and health emergencies, which will increase regional and global capacity. Let me now move to migration and health, which is high on the agenda across the region. The situation is becoming more challenging with the increasing influx of refugees and migrants to many European countries, calling for an urgent response to their health needs. I issued a statement on our website highlighting the public health implications, which are challenges for both the refugees and the receiving countries. The Common Association of Migration with Importation of Infectious Diseases is not evidence-based. Countries should implement policies that give migrants access to a broad range of health services, including those for prevention and care. This will also be beneficial for the receiving country's population. We continue to respond to increasing demand and provide support to affected countries and delivered emergency kits to address refugees and migrants' health needs. We develop new research and evidence to support decision makers in making policies on migrants' health. I want to thank the government of Italy for its support in this area. The ministerial launch today is dedicated to migration and health, and we look forward to receiving your guidance on how to take forward this important topic. The conflict in the Syrian Arab Republic sent 2 million refugees into Turkey. We are working with the government of Turkey, which has demonstrated an outstanding performance in managing the response to the refugee influx. We are leading the health cluster to assist Syrian refugees in Turkey. We are contributing to the whole of Syria approach, following the UN Security Council Resolution 2165 in collaboration with the Eastern Mediterranean Regional Office. In response to the humanitarian crisis in Ukraine, which affects more than 5 million people, we are leading the health and nutrition cluster to coordinate the response to internally displaced persons and affected communities. The WHO teams in the UN field offices are facilitating the delivery of medical kits, supplies, and medicines to treat hundreds of thousands of people. The network of mobile emergency primary healthcare units and health impact specialists plays a crucial role in assessing health threats and delivering health services in difficult-to-reach areas. Ladies and gentlemen, it has been an exciting year for work on antimicrobial resistance with the adoption of the Global Action Plan. Europe is leading the way. Almost half of the member states in Europe have an intersectoral coordination mechanism and national action plans. The Central Asian and Eastern European surveillance of antimicrobial resistance network, which now includes around 250 laboratories, is supplementing EU surveillance data. I am happy to inform you that CSAR published its first report last month. The Antimicrobial Medicines Consumption Network allows us to monitor the use of antimicrobials in 17 countries outside the EU, providing evidence from 45 member states. Building on the success of the European Antibiotic Awareness Day, we are shaping a global campaign to launch World Antibiotic Awareness Week in November. This year, we hope that all 53 member states will mark the week. Ladies and gentlemen, we do all this work with you, member states, and with partners to achieve our goal: better health for all, equitable and sustainable. We worked with all member states, tailoring support to their priorities, needs, and circumstances. We now have a fully functional network of national counterparts, which streamlines all correspondence and improves the knowledge and information flow. I had the privilege of visiting many countries, meeting with heads of states, prime ministers, and ministers, advocating health and promoting intersectoral work. With the Director General, I was honored to receive the Turkmenistan State Award from His Excellency the President of Turkmenistan on behalf of WHO in recognition of our collaboration over the past 2 decades. On behalf of the organization, I was also honored to receive the gold medal of the Portuguese Minister of Health for distinguished services in Portuguese multisectoral health policy development. We welcomed ministers and senior delegations to the regional office and gave member states a stronger voice by a new initiative, the Country Days. They have proved to be valuable platforms for identifying priorities for our joint work. To ensure that the regional office is a strong and evidence-based organization relevant to the whole region, we continue to increase our technical capacity. We empowered country offices by delegating more authority and responsibility to them. I thank all my staff for their dedication and hard work. We invest in partnerships to increase policy coherence, improve health in our region, and serve member states more efficiently. I am pleased that many of our partners, including civil society organizations, are here with us today. This year, the partnership session with the participation of the Global Fund and Gavi Alliance will focus on opportunities and challenges for successful transition from international to domestic funding. In our work as part of the One UN, let me highlight one important element. We coordinate a regional UN thematic group on NCDs and social determinants for health to support implementation of the UN Political Declaration on NCDs and Health 2020. We are pleased that health and NCDs are prominent in recently developed United Nations Development Action Frameworks, and we look forward to their joint implementation. And finally, ladies and gentlemen, the WHO reform is an important priority, and it will remain an important priority. Later today, we will discuss continuing reform initiatives on governance, and will also present the work on how to strengthen accountability and transparency in the regional office. But here, let me make very briefly 2 points. We continue the biennium on a solid financial foundation, with more flexible funds that are now distributed strategically. Thanks to you, Member States, and to the Director General for making this happen. The World Health Assembly's adoption of the program budget for 2016 and 17 with an 8% increase in the budget was a historic moment, demonstrating the trust of the Member States. The regional implementation plan for the program budget, which will be presented to you on Thursday, will be the main instrument of corporate accountability in the region and the contract between you and me. Your Excellencies, ladies and gentlemen, we have great responsibility for the health and well-being of our populations. Next week, we will approve the 2030 Agenda for Sustainable Development. Let us make sure that we are ready and we leave no one behind. Thank you for your attention.